How does exposure therapy extinguish fear and PTSD? Imagine facing your fears in a safe space and realizing they are not as dangerous as they seem. That's the core idea behind how exposure therapy helps reduce fear in post-traumatic stress disorder. When someone experiences trauma, their brain forms strong associations between certain cues or memories and feelings of danger. These cues could be sounds, sights, or situations that reminded them of the trauma. In PTSD, these associations become exaggerated, causing intense fear responses even when there is no real threat. Exposure therapy works by carefully and repeatedly exposing individuals to these trauma-related cues or memories in a controlled environment. The goal is to help the brain learn that these cues are no longer dangerous. This process is called fear extinction. It is a form of learning where the brain updates its understanding, recognizing that the stimuli it once feared do not predict harm anymore. Over time, this reduces the physical and emotional reactions tied to those cues. The therapy mainly involves engaging parts of the brain responsible for fear regulation, like the medial prefrontal cortex and the hippocampus. The medial prefrontal cortex helps inhibit fear responses, while the hippocampus provides context, helping the brain distinguish between safe and threatening situations. During exposure therapy, repeated safe encounters with trauma reminders help these brain regions work together to reframe the meaning of the cues from threatening to safe. For example, a person might gradually confront situations or memories they have been avoiding, such as visiting a place linked to their trauma or talking about their experience. Each exposure is done in a way that ensures safety and minimizes distress. As they repeatedly face these cues without any negative outcome, the brain begins to weaken the original fear association. Instead of feeling overwhelmed, the person starts to see these cues as non-threatening. It's important to understand that fear extinction doesn't erase the traumatic memory itself. Instead, it creates a new memory that tells the brain these cues are safe. This new learning helps suppress the fear response when encountering similar cues in the future. However, extinction learning can be context-dependent, meaning that fear might return in different situations if the new safety learning doesn't generalize well. Some individuals may find extinction learning more challenging if they have difficulty processing safety signals, or if their brain's fear regulation systems are less responsive. But with enough consistent exposure, most people can experience a significant reduction in fear responses. Cognitive skills like attention and working memory also support this process by helping individuals stay engaged and regulate their emotions during therapy. In summary, exposure therapy reduces fear and PTSD by harnessing the brain's natural ability to learn new, non-threatening associations. Through repeated, safe encounters with trauma-related cues, the brain learns to recognize these cues as harmless, gradually extinguishing the intense fear responses that have been ingrained. This process involves complex interactions between brain regions responsible for fear, memory, and emotional control, and it requires patience, repetition, and proper guidance from trained professionals. If you or someone you know is considering this approach, consulting a qualified mental health provider is essential to ensure it's done safely and effectively.